Familial hypercholestrolemia is an inherited condition in which cholesterol in the blood is too high. A person affected by this disease normally inherits a normal copy of the gene from one parent and an affected copy of the gene from the other parent. The LDLR, APOB, PCSK9 genes have autosomal dominant patterns of inheritance, and the LDLR AP1 gene has an autosomal recessive pattern of inheritance. The LDLR gene encodes the low-density lipoprotein receptor known for its connection to FH. Both genetic and environmental causes play a role in this genetic disease. Lifestyle choices like what you eat, how much exercise you get, and your intake of tobacco products highly affect the amount of cholesterol in the blood. Genetic factors such as sex, age, and other chronic diseases impact the outcome of this disease. Too much cholesterol can lead to an increased risk for developing heart disease. When excess cholesterol collects on the inner walls of the blood vessels, especially the arteries, the risk for high cholesterol conditions increases. This buildup can clog the arteries and restrict the blood flow to the heart. 23andMe tests for one variation in the APOB gene and 23 variations in the LDLR. The variant in the APOB gene is the most important. This variation impacts a protein called apolipoprotein B. The typical function of the protein is that it helps LDL cholesterol bind to LDL receptors on the surface of the cells. Some variants reduce the ability of LDL cholesterol to bind to this receptor. This variant is expressed mostly in the liver cells. One major limitation of the 23andMe test is that it only tests for 24 variations when there are over 1,000. It doesn't test all known alleles of the gene we examine or variations of the known genes. We will include approximately 75 genetic variations on our SMP chip test because we will test for 50 more variations in the PCSK9 gene. The PCSK9 gene provides instructions for making a protein that helps regulate the amount of cholesterol in the bloodstream. The variations of the PCSK9 test cause an altered amount of proteins that cause low-density lipoprotein receptors to be broken apart quicker than normal, causing a reduction in the receptors in the liver. With fewer receptors, people with mutations in the PCSK9 gene have a higher risk of high blood cholesterol levels. The high levels of cholesterol are deposited in the skin, tendons, and most importantly, the coronary arteries. These variations make sense because the PCSK9 regulates cholesterol levels, and a mutation can cause deregulation, making cholesterol levels higher. The benefit of our test is that it will test for variations in the PCSK9 gene, whereas 23andMe only tests for variations in the APOB and the LDLR gene. There are over 50 PCSK9 genes that have mutations that can cause high cholesterol. It's been shown that there is a strong correlation between having a mutated copy of the PCSK9 gene and developing high cholesterol. The base risk for heterozygous form of FH is 1 in 250 people, or 4%. Mutations in the PCSK9 gene account for about 1% of the cases of FH where there is a known genetic mutation. This makes the actual risk of people having a mutated copy of the PCSK9 gene and developing high cholesterol 4.4%. Our test still contains limitations, as some alleles only cause a very slight increase in risk since they all have a magnitude of 0, making them harmless. But keep in mind, many variations that impact the trait might still be unknown. If someone does not have a familial history of high cholesterol or corneal disease, we will not recommend that they take this test as it is not needed since carriers of FH have less than 20 times fold higher risk for coronary disease. However, if someone does have a family history of the heterozygous form of FH, this makes the actual risk of coronary disease 8%. While testing positive might spike anxiety for some people, it is much better in the long run that they know sooner rather than later. Testing positive for this genetic disease can encourage the patient to eat healthier, and knowing the results from this test can also help them prepare better financially for the future in case they have increased medical bills as a result. A lot of people we know are affected by high cholesterol. Some general rules to make sure it does not become an issue leading to coronary disease or a heart attack are to not smoke and avoid secondhand smoke, treat high blood pressure if you have it, eat foods that are low in saturated fat, be physically active, and reach and maintain a healthy weight.